This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from World Neurosurgery 2026 titled A Protocol to Preserve the Dural Safety Margin During Simultaneous Hybrid Lumbar Unilateral Biportal Endoscopy and Cervical Laminoplasty.
This is a timely topic, Laura. We are seeing a significant shift towards simultaneous single-stage decompression for tandem spinal stenosis. The goal, of course, is to reduce overall recovery time and hospital stays, which patients and hospital administrators both love. But as we push the boundaries of what we can do in a single session, we have to look at the physiological interactions between two operative sites.
Exactly. And this paper specifically looks at the hybrid approach. That's the combination of a traditional open cervical laminoplasty and the increasingly popular lumbar unilateral biportal endoscopy, or UBE. The study raises a concern that I think many residents might overlook: the role of hydrostatic pressure.
It's a critical point. In a standard open case, we don't worry much about the lumbar pressure affecting the cervical spine, but UBE is a different beast. It requires continuous saline irrigation to maintain visualization and control bleeding. Ilara, walk us through the hypothesis the authors presented regarding that irrigation.
The authors hypothesized that the continuous saline irrigation used in UBE creates a level of hydrostatic pressure that is capable of increasing intracranial pressure via the subarachnoid space. Because the spinal canal is a continuous system, that pressure doesn't just stay in the lumbar region.
Right. And that leads us to the iatrogenic risk mentioned in the paper. If we're performing a cervical laminoplasty, where the cervical dura is exposed and vulnerable at the exact same time as a lumbar UBE, that transmitted pressure can cause the cervical dura to bulge or expand.
Precisely. They call this a threat to the dural safety margin. When we are performing a laminoplasty, we rely on a certain amount of space between the bone, our instruments, and the neural tissue. If the lumbar irrigation is driving up the pressure, the cervical dura can expand into our working space, significantly increasing the risk of an accidental durotomy or cord injury.
It's a fascinating look at the fluid dynamics of the thecal sac. For the residents listening, think of it like a hydraulic system. You're pumping saline into the lumbar inlet, and that pressure is looking for an outlet. If the cervical spine is open, the dura there will bear the brunt of that transmitted pressure.
The paper emphasizes that this is particularly dangerous during the simultaneous phase. If the surgeons are working on both ends at once to save time, the cervical surgeon might be unaware that the dural tension they are seeing is being driven by the pump pressure in the lumbar region.
And that's why the study proposes a specific protocol to preserve that safety margin. We have to be mindful of the irrigation pressure settings and, perhaps more importantly, the sequencing of the decompression. If we don't manage that hydrostatic transmission, we're essentially working on a moving, or at least a pressurized target.
I found it interesting how they focused on the subarachnoid space as the primary conduit. It reminds us that even though we think of these as two separate pathologies, cervical and lumbar, the CSF space makes them one continuous physiological environment.
Very true. So for the practicing neurosurgeons out there, the takeaway here is that while the hybrid approach is efficient, it demands communication between the two surgical teams. If the cervical surgeon notices the dura becoming unusually tense, the first question shouldn't just be about the patient's blood pressure. It should be, what is the irrigation pressure on the UBE pump right now?
It's a great example of how new technology, like UBE, requires us to rethink the safety protocols of tried-and-true procedures like laminoplasty when we combine them. The study really highlights that protecting the dural safety margin is paramount.
Excellent summary, Alara. This paper is a must-read for anyone looking to incorporate more minimally invasive endoscopic techniques into their complex spine practice. It's not just about the tools, it's about the physiology.
Definitely. Well, that's all the time we have for this episode of the Neurosurgery Hub podcast.
Join us next time as we continue to dive into the latest literature shaping the future of our field. Until then, keep learning and keep operating safely.